Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, according to the United States Department of Health and Human Services, Office of Inspector General, dated July 10th, 2025, UAB Medical West agreed to pay $100,000 for allegedly violating patient dumping statute by failing to provide stabilizing treatment. And this location is at 5000 Medical West Way, Bessemer. The University of Alabama at Birmingham entered into a $100,000 settlement agreement with OIG. The agreement resolves allegations that UAB Medical West violated the Emergency Medical Treatment and Labor Act, EMTALA. Based on its investigation, OIG concluded that in May 2023, UAB failed to provide stabilizing treatment to a patient who presented to their freestanding emergency department, ED or ER. Specifically, UAB Medical West diagnosed the patient with the emergency medical condition of acute urinary retention. The UAB West staff were unsuccessful in their attempts to catheterize the patient and failed to provide any pain relief. Although UAB Medical West had a urologist on call for the freestanding ED and access to specialized urology supplies at its main emergency department, UAB discharged the patient with instructions to drive himself to a different medical facility for a urology consultation and stabilizing treatment. I also was a patient and customer with UAB, and I'll go into my own issues briefly. The X-ray, MRI, and CT images you can see in this video, these are the injuries that I had in my upper neck and head when I stood 5 hours at the main UAB emergency department in downtown Birmingham in 2019. I never saw a doctor. My own experience dealing with University of Alabama at Birmingham, UAB medicine repeatedly is when I had a very serious health concern and time was of the essence. I was let down again and again, experienced stalling tactics. You can do some searches on my YouTube channel, and all of my incidents with UAB have been thoroughly documented. I was put on a waiting list to see a UAB neurology specialist in 2019. 3-month waiting list, referred by Ortho Alabama Spine and Sports orthopedic Dr. Perry L. Savage Sr. As the appointment date drew closer, I received a phone call and was told that because they were moving locations, I would have to wait an additional 4th month before I could see a doctor. Likewise, I've got a recorded telephone call with UAB Primary Care in Leeds, Alabama from March 2023. The young lady on the phone tells me that I will not be able to see a primary care doctor, that's a regular jack of all trades family doctor at their location, immediately or in a timely fashion, and in fact would have to be put on an 8-month waiting list. I'll explain my unbelievable experience at the UAB emergency room in 2019. Standing room only, and the only way they would admit patients out of the triage queue is if they collapsed and fainted on the emergency department waiting area floor, which several patients did during my 5-hour wait. Alright, so patient dumping is a reality when it comes to dealing with UAB. It's good to see some action being taken out there. A lot of words and talk are exchanged. Words and talk have a little to no value, in my own opinion. Additionally, UAB recently closed the deal to acquire the St. Vincent's Ascension hospitals in the Birmingham, Alabama area. Their business methodology and philosophy will be applied to these new facilities as well. And anybody who goes to these places with your own health care in mind needs to be aware of the realities. So in brief, I had a broken skull injury. I had this from around July 2018. I went around to many doctors and hospitals in Birmingham. Tried to get this thing diagnosed. And we're not even talking about treatment, just trying to find out what happened to me. And I repeatedly found that the doctors they wouldn't diagnose this thing. They wouldn't look at it for some reason or another. I don't have insurance and I have no source of income, and I think this may be part of the reason. And this is in the hospital. This is a violation of a United States federal law, and this is EMTALA, EMTALA. And this states that when you go to a hospital in the United States of America, the hospital is obligated to treat your injuries, but it hinges on the diagnosis. And what I found happened to me was the hospitals will repeatedly misdiagnose me in order to circumvent complying with this law. All right. But what I did was, okay, so I'd go in and I'd say, man, my neck feels like it's broken. So they'd come back and they'd say, oh, you just pulled a muscle. And they would tell me there were no injuries that showed up in the CT, X-rays, and MRI scans that I had done. Okay, well, there's another law in America, and this allows patients to obtain their medical records. And yeah, I found out some of my medical records were edited to cover the doctors and nurses' errors. But yeah, I got my own records, and here's what I found in many of them. And in the images, you can get your own images that are taken also. So in the images, exactly in the area where I had the pain that I went into the hospital and complained about, I found that my skull was broken. It's in the basilar area of my skull, around the occipital condyle condylar canal, possibly foramen magnum. This is a very serious injury. I had a hole in the bottom of my skull, and there's fluid inside your skull between your brain and your skull, and this leaked out into a wound in the upper area of my neck, and this all shows up in imagery. So because I couldn't get proper diagnosis and treatment, this area became gradually infected, and then later I found out it was infested by microorganisms, parasites, and worms. And all of these things can be seen in the MRIs and CT scans. It was that bad. Alright, so this brings me to our video today. And this deals with UAB Hospital. So I went to UAB, and they have some expertise in many of the areas that I think concern my injury, and we never got to test those because they wouldn't see me. So yeah, I went to the hospital. It was in June 2019, and I was triaged. I complained of I told them I thought my neck was broken or my skull was broken, and I also said that I possibly had a CSF leak. I took in past imagery, MRI, CTs, and X-rays that show the injury itself, and I showed this to the triage nurse. So I was triaged, and I stood in the waiting room, and I waited there for 5 hours. So after 5 hours, it was like 1 or 2 in the morning, and I couldn't stand any longer. The waiting room, it was like full of people. There were no chairs or seating available. So yeah, I had this injury. I stood 5 hours. I was holding on to consciousness the best that I could. Hopefully try to see a doctor. And the doctor, they never saw me. I was never called back to the back of this hospital to be looked at. So, yeah, I believe that the UAB, they're using this method of waiting out patients with the 5-hour waits. And when I was there, yeah, I heard about people who were sitting there for like 10 hours. So yeah, I think UAB, they're using the triage waits as another method to circumvent EMTALA. They're waiting people out. So if you stand there for 5 hours and you can't stand any longer and you leave, they don't have to see you. I filed a complaint against University of Alabama Birmingham Hospital from this visit, the Centers for Medicare and Medicaid Services. So they launched an investigation, and they investigated UAB Hospital for my complaint. And I got this back in January of 2021, and it's from the Centers for Medicare and Medicaid Services. And they tell me that they did not confirm violation of the emergency care obligations for UAB Hospital. Yeah, I think this is very unfortunate. My concerns are valid, and I'll go into what happened to me briefly. So yeah, I went in there, stood for 5 hours, was not attended to. My triage condition, I just explained it. You can see here, these are my medical images. This is the condition that I had when I was waiting for 5 hours and not attended to by this hospital. So yeah, the lobby, the waiting area, it was full of people. There were a lot of homeless people in this waiting room, a lot of drug addicts. And I was standing near the front desk. I watched the people come in and out, and I watched them call the triage list to the back to be attended to. And their triage list is strange, all right? By and large, okay, I had this injury, right? But by and large, the people they were calling back to be attended to, these were like withdrawing drug addicts and stuff. And I don't know how this is listed as a more important condition than what I had, for example. But yeah, there were mosquitoes that flew around inside this waiting area. That's not good. Mosquitoes are a disease vector. A mosquito is like a flying syringe, all right? So the mosquito flies through the waiting area, and it lands and it sucks the blood out of one person, right? So if it lands on you or lands on me, this it can pass diseases around, and this is not good, and especially UAB, not acceptable. I got water. They had a public water dispensing machine. I poured water to a styrofoam cup. Small black worms dropped out of this machine into the cup that I poured water into, and I can't drink that. The other thing that I noticed, the atmosphere of the triage area in the waiting area of UAB Hospital in the emergency department, it's like a college dorm room. Yeah, and many of the nurses there and the medical staff that you can see, they are visibly young, like incredibly young. And then another thing, yeah, around this emergency department in UAB Hospital, there are all these fast food restaurants. And the nurses and the staff that worked in this place, they had takeout fast food and drinks. They were laying around on the triage table, right next to all this expensive medical equipment. They had like Domino's pizza boxes and all this stuff, and they're sitting there eating. At the same time, they're attending to these triage patients, and this is disturbing. This is not a professional environment. That's my opinion. But UAB, they have plenty of money. Obviously, you can look around at the south side of downtown Birmingham. You can see all the real estate that's owned by UAB, and then all the other companies that exist around UAB that service UAB. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the x-ray, CT, MRI imagery, and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, EMTALA. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network, LLC, and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time.